under 200 board-certified pediatric neurosurgeons in the United States. To perform pediatric neurosurgery, you need a large team and a large system in place, and St. Joseph's Children's Hospital provides that for us. In the operating room, we have a lot of specialized equipment that most community hospitals will not have available. We need special drills, we need special instrumentation, we need microscopes, we need neuronavigation equipment so that when we do deep brain tumors, we can do an MRI scan of a child and we can correlate that with the instrumentation that we're using in surgery so that we can do the safest, smallest operation that can be done for the child. So it takes a lot of special people. We also have to work with a lot of different other specialists like the oncologists or the neurologists, and a lot of the patients have to see multiple specialties. So here at St. Joseph's we have a patient navigator who helps those patients coordinate different appointments and things that need to be done so that families can live their lives and not spend all their time in the hospital or seeing doctors. We essentially specialize in treating children with neurosurgical conditions. A lot of the things we treat are things children are born with, like hydrocephalus or spina bifida, and of course those patients need lifetime care. We also treat children who get brain tumors or spinal cord tumors, and of course, unfortunately, we have to treat trauma as well. That may be related to child abuse, which has really increased with our economy being problematic, and of course car accidents and other things. Well, I think the most normal thing that parents want to know is, what does the future look like? And a lot of times the process, for example, when you have a brain tumor, that process takes a while because first we have to do the operation to find out what kind of a tumor it is, and then we have to make a treatment plan. Some tumors are benign, and once we surgically remove them, they're effectively cured. And some tumors are malignant and need other kinds of treatments. And it's a waiting process because it can take 1 to 2 weeks for the pathology to come back and for the treatment plan to be made. And it's natural. Everybody wants to know exactly what the future holds. And it's a hard process. Well, we try to have them focus in the moment. Essentially, we need to get the child through surgery and get them back and healthy and active again, and take one day at a time. It's really the only approach. My name is Sarah Gaskill, and I've been a pediatric neurosurgeon for 17 years. I completed my training at Duke University and practiced in Texas for 13 years, and have been here in Tampa for the past 4 years. Well, we had a child who had back pain and was on an MRI scanner at an outside facility and became paraplegic and unable to urinate in the process of having that MRI scan. She was flown by helicopter to St. Joseph Children's Hospital. Within an hour of arriving at St. Joseph's, she was in the operating room and she had a complete excision of her tumor. Now, it unfortunately did turn out to be a malignant tumor, but she has lived 2 full years before she's had a recurrence. And her mother has recognized that she got 2 years of life with a very functional, happy child that she would have lost without that treatment. Well, you know, I always have to remind myself, people ask, how can you do this? And we often ask that of others who do things that I couldn't do. And I can do this because I don't give the children the diseases, but I do everything I can to fix them.